I'd like to introduce John Wright. John Wright is a remote area nurse working for 19 years in South Australia and Northern Territory, and my understanding is you're currently working in Tennant Creek.
That's correct.
John, I'd like to know what it is to be a rural remote nurse.
It's about the broadness of the work that you do. When I worked in a big city hospital, I had a particular role which was very narrow focused, and I was very good at it, but it was very narrow. So when I went to work out in the country, I had to do a whole lot more than what I did in the big city hospital. And then when I went remote, that was a whole different world.
Now, you haven't always been a nurse. You've got a little bit of a history about farming.
That's correct. I started my working life as a farmer, a shearer and truck driver, and I did that for a number of years until I had to give that up due to drought and high interest rates. So I went back to finish year 12, which I had given up on, and went on to university, and eventually somehow ended up getting a Bachelor of Nursing and becoming a registered nurse. So that's a very interesting story in itself, but yeah, I wasn't always a nurse, but those skills of being a country boy on the farm, fixing things on the land, has been really valuable in becoming a remote area nurse.
How have you used critical analysis in your roles as CNC and educator, and the importance of that?
One of the things I'm really passionate about is that nursing is more about thinking than about doing. I really believe that we could teach anybody to do the tasks of nursing, but to be a really good nurse, to be effective, particularly in rural and remote areas, you have to think. You've got to think about what you do. You have to think about why you do it. And I'm very pleased to see in the framework that there's a very strong focus on those cognitive aspects of being a registered nurse in those settings. And I think having that guidance for educators, it helps us to go away from that task focus, which we rightly have to have when we're starting with beginning practitioners. But I think to be any good at it, you have to really quickly move past the task focus onto a patient focus, a client focus, and much, much more than ever before, a cultural focus.
But what about the nurse who is Aboriginal Torres Strait Islander and the framework with Domain 1 supporting cultural safety?
The issue of cultural safety has been a vexed one in Australian history, as we all know, and we all recognise, or certainly hope we all recognise, that the contribution of Aboriginal and Torres Strait Islander nurses and midwives and other Aboriginal and Torres Strait Islander health staff are absolutely crucial to providing health services. So the focus is not just in the framework. As you're well aware, the NMBA Code of Practice is now strongly incorporating cultural safety as part of the regulatory framework. I think it's pushing us towards this recognition of how critical our Aboriginal and Torres Strait Islander colleagues are, and my hope as a practitioner and an educator is that will help us to support them. As we learn more about cultural safety and maybe even going further into cultural humility, I think we'll be in a stronger position to support that aspect of our workforce, because it really is the only way we're going to succeed in what is a vexing problem for our nation.
Tell us more about how you would use the framework, if you had it at that time, to transition to rural and then to remote practice.
The interesting thing is that I had no idea what a remote area nurse role was. I'd never heard of it before, and I was quite startled once I got into the workforce to realise that only 10% of the work was actually work that I was familiar with. So things like immunisation and child health checks and all those things, I'd never done them, never heard of them. Yeah. And there was no training that I was aware of, no induction, no orientation. So to look at the framework now, I think this is an excellent roadmap for how you get to be a rural practitioner or a remote practitioner. It gives you some guideposts, some tools and some markers about what you need. And to give a quick example, if you're working in a community that has a lot of chronic disease, for example, or maybe a lot of suicides, for example, then you could specifically get some more training in that area so that you can be more effective in that community. And this is not something you're going to get in a big city hospital where you specialise and become very good at one particular skill set.
Thank you, John, for sharing your expertise and your insights around the framework today. Appreciated.
Thank you.